A new study finding people under 50 who use cannabis are more likely to have a heart attack or stroke than those who don't. Boston University researchers say the drug may create small defects in coronary heart lining. Health expert Dr. Amina Marhom joining us now to break this down for us. Dr. Amina, always good to see you. Thanks for being with us.
Hey, Homa, great to see you again.
People always say a little weed doesn't hurt anybody. It's not like cigarettes. It's a lot safer. It's a lot healthier. This is proving otherwise. So tell me what we're seeing here, what the study's finding.
Absolutely. I just had a talk with a patient this morning, and the first thing he said to me is, Doc, please don't take away my weed. Whatever you do, don't tell me it's bad for me, because there's a conviction that this is natural, it is safe, it is from the earth. But this enormous study in the Journal of Cardiology here is showing that if you're under 50, you could be up to 6 times more likely to have a heart attack. That's a huge risk for somebody who's under 50, who's typically not at risk for having that cardiovascular disease. This now adds to the fact of what we know of an increase in anxiety, depression, and even up to a 3 times increase of a risk for psychotic illnesses. Huge risks that we're talking about, Homa, that public need to know about.
And I think this goes for everything without saying if you're going to partake, everything in moderation. Is there anything you can do to reverse the risk besides putting down the weed?
There sure is. The way I approach this combo is, look, I'm prescribing medicine and so are you. Let's talk about the risks, benefits, and alternatives. So now you know what the risks are, you know what you find to be the benefits. For example, some people will say, hey, it really helps me sleep. So I'll say, is there a possibility there's a medicine that can help you sleep that's a little bit cheaper and a little bit safer? So the big question is, what could be an alternative for you besides what you're using now?
And is this applicable to, are we talking edibles? We're talking smoking, vaping in any capacity. If you are ingesting cannabis, these effects are, they're going to take effect on your heart?
Unfortunately, it's a little bit across the board, regardless of the mechanism that you're taking in the cannabis. But there is a little bit of a dose dependency. The more you're using, the more at risk. And to what you were discussing earlier, this is because it's basically affecting the plumbing of the heart. The lining of the vessels that are bringing blood and oxygen to the heart are being compromised by what we're smoking here. So the big message, the big takeaway is that this is not something that's just natural and safe and from the earth, and there are safer alternatives for us to consider.
And we know the heart is a muscle. It needs to be exercised just like the rest of our physical muscles. So would that help?
It definitely does. The being able to stay moving and stay active, and be on the move is a really helpful thing for us to maintain our cardiovascular health overall. The other part, like any muscular health for our entire body, it's not just what we put out, but also what we bring in. So making sure that what's coming into our musculature is healthy, as well as what's going out, and sort of keeping our cardiovascular system pumping really well.
Sure. Dr. Amina, thank you so much. Big news coming out of Boston. A lot of people are paying attention to this. We appreciate you. Good to see you as always.
Absolutely. Thank you for having me.
All right, we're going to take a quick break. The DMV Zone is coming right back after this.